A few months ago, I spoke at an organization called Bridge to Hope in Pittsburgh, where we had 585 families who have all lost somebody to this terrible epidemic. One school teacher has lost 6 children in her class in 1 year. Imagine that. And the U.S. Attorney and I went there to speak, and we both came out with tears in our eyes and a further resolve to end this problem in our lifetime. I was a Boy Scout, and I was told that you always leave your campsite better than you find it. And I'm getting close to retirement, and I can't get my campsite better than I found it. So we have a way to go. I want to give you some hope, but I want to tell you something about this problem. We have a way to go. It's something that we still don't have our heads or our arms around. Sitting in Washington, putting together the National Overdose Prevention Report and Plan, which is on the website, and if anybody wants to see it, it's designed for communities like Talbot County, and I can share it with you, and we can even talk about it, but it pulls together a whole network of services, law enforcement alongside of treatment, alongside of families, alongside of peers, alongside of those in recovery and community leaders, and a will and a desire to move this problem out of our counties and out of our communities. It is only through doing that that we will stop it. There's a lot of good things happening, but I should also tell you that as I'm standing here, there are at least 2.6 million of our fellow Americans struggling with this problem. Last week I was in Ohio working, where some states are making great progress, but on Friday night alone, there were 135 overdoses in the city of Cincinnati in one night. And it wasn't just carfentanyl, it was everything that we see here. On Tillman, sometimes I think we get a bad rap. We hear a lot that the problem is there. There is a problem there for sure. It's everywhere. And we now have a Narcotics Anonymous meeting, a mental health outreach with For All Seasons, and we're working on getting a parent support group with Mariah's Mission and some other things. So we're very proud about making an effort there. In this 2.6 million, I can tell you that the problem is non-discriminating. We had 47,000 deaths in 2014. The data that the CDC has for 2015 will be higher. It has not been reported yet. It's an election year. It will be reported, probably sometime later. We don't have in place across America or in communities all the systems we need or the network. And law enforcement that has worked with us from the highest levels, the drug enforcement, the federal officers, the local officers, the sheriff, others have all said, we can't do it alone. We need all of us together. And that's the first time we've sat around a room. I looked at 200 deaths, overdose death records last year in different communities to see what I could learn from seeing what happened to those with the overdose. And what I found out is almost 70% of them came into our system before they overdosed, and they didn't stay in our system. By system, I mean our jail or our criminal justice system or our treatment system. Somehow we have to make our programs stick and work. One of the new things we're doing, of course, is Narcan, and I'll talk about that in just a minute. But it's not just these people. We've had a 6-fold increase in the number of babies born addicted, passively addicted, or dependent to heroin in this country in the last 5 years. 6-fold. That's something our hospital systems need to get ready and address. These are lifetime maladies that carry enormous risk if we don't treat. And yet if we do treat early with prenatal care, we can get a healthy outcome. We see our medical practices changing. Our veterans are suffering right now. There's more opiate use and medication misuse in the military than there is in our civilian life. And yet we won't acknowledge that for many, many reasons. But when our soldiers and sailors come home, over 40% of them are coming home with a medication issue, often a pain management issue that they're going to need help for. And when they come back to communities that don't have jobs waiting and don't have economic means, we're letting them alone too long. We need a stronger VA intervention approach. And we're working at that on the federal level, trying to get the VA system just to open its doors and talk to each other back and forth so we can do that. The elderly people, I've heard several times from people here tonight, 1 in 7 of our elderly are dealing with substance use, probably more if I count alcohol. So they wash their pills down with alcohol. They borrow pills. They don't see doctors. They don't understand the consequences of interactions of pills. We need to get more knowledge. This is why the problem is what it is in our country today. And of course, prescribing. The prescription practices have to change. Up until 2006, we taught every physician that pain is a fifth vital sign and no American should have it. And every doctor who was trained from then learned to write prescriptions to remove pain, not realizing that in many cases they were masking pain, and when it finally came back, they didn't have the medication appropriate to manage what they had to deal with. So medical schools now, 132, I did a survey of 132 medical schools, 2001, only 10 offered a course in substance use. 10. Today, they've gotten together and they've sworn that they will change their curriculum within the next 2 years, and every doctor practicing will have a course in substance use and pain management so that they're better prepared. 42% of our practicing doctors in this country feel that they were not prepared to address, screen, or treat substance use. 42%. Why did we get to this problem? Big Pharma came along with powerful drugs and medication that maybe we didn't need. We had some very strong drugs. We came out with OxyContin, which was 5 times stronger than heroin. Then we came back now with other drugs, fentanyl, carfentanil, at least 3 others. And these medications, I don't know one single person in this country who can take 4 or 3 OxyContin a day and not end up with a dependency problem at the end of the month. So prescription is the first thing we have to change and get those people into sound medical treatment that is not discharging them when they get to the point of crisis. The second thing we need to realize is the power of this illness. Nobody I know who was or is a person with an addiction, and notice I say that because I'm changing the language. These aren't addicts or junkies, these are persons with addictions. The children born to the mother who is addicted are not addicts. They are children born passively dependent, and we have to change our language if we're going to break the stigma. The second thing is the power of these drugs. These drugs have them. They don't have the addiction. Once you get to the level of addiction in the medical compendium of illnesses, it has you. And we have to take those people offline, put them in a place where they have a chance. And our treatment systems aren't here. They aren't there yet. There is only enough capacity in this country to treat 1 person for every 10 who need it in America today. That's how scarce treatment is for this problem. So once we realize the power of it, once we move into the intervention of it, form our community networks, we can begin to do something, putting a treatment system together and stop moralizing and criminalizing this illness and put it where it belongs in public health for public solutions that involve public safety and public health working together side by side in our communities. The third thing that we have to realize besides the power of the illness is that to many people, sadly, these drugs are a form of an economy. They become in a market, in a high or tough economy, not an acceptable and certainly not excusable pharmacological Bitcoin. Too many people are trading in it, and this is where we need law enforcement to step in. This is a form of a livelihood and an economy for too many people, and we need to clamp down and say, not in our backyard, not here will we do that. So with addressing these 3 things, we can come to the solutions of this problem eventually, changing practice, opening up treatment, expanding residential and medicated assisted treatments. And I know we have some here in Talbot County, probably not enough if there's only 1 slot for every 1 person out of 10. And then get them there so we can stop the raging illness long enough to do an intervention that maybe gets them off these replacement drugs if they can get off it.